triceps. Okay? And then stabilizers are other muscles that facilitate an action by stabilizing something. For me to move my arm around, I need to have my scapula held in place. So then there's a lot of muscles that can stabilize and hold the scapula while the arm is moving. And then also, some of these terms can overlap, where you'll have a neutralizer which will take some action or stop some action from occurring, which can be similar to a stabilizer. And then you have nerve tissue. Okay, what are the properties of nerve tissue that make it unique? Yeah, it has electricity, electrical activity, so it has excitability, reactivity, things like that. But it doesn't produce, it doesn't contract, right? But it still provides impulse for actions to occur in the muscle. It's either going to, it's going to move a muscle, or it's going to go to some gland, produce some type of activity. But it can be stretched and torn, or a pressure can be applied to it, like if you have a disc herniation, it's putting pressure on the nerve root, and that's going to cause radiating symptoms, things like that. Okay. And then vascular, again, that could be acted upon where it's going to restrict the flow, either arterial blood, so blood going out, or it can stop the flow of venous blood coming back. And as you know from the first part of this class, there's a lot of different things can happen when you're talking about restricting blood flow to the brain. Okay, so then those are all the different tissues that we're going to talk about as we go through the different parts of the body. And that's the biologic part of biomechanics. And then there's the mechanical part of biomechanics. Okay? So then you have two different main categories of things that happen to the body. One is physiologic, meaning that it's a normal function that you do through the course of your day. Or there's a term we call activities of daily living. Okay? So just while you're sitting there, there's certain forces that are acting upon you and your body tissues. Okay? There's gravity that's pressing down on it. You may have some postural issues where certain muscles are tight and they're pulling forward like this. Then your body adapts to certain postures, different things are going on while you're just sitting there statically. Okay? Then you have dynamic, which is that's when you start talking about movement, and how the body moves and what forces that affects onto the joints. And then activities of daily living. That's where somebody's had an injury, it's going to, you talk about, like if we write reports or something like that, you say how something's affected their activities of daily living. Like if it's a medical legal case and somebody's been injured as a result of an auto accident, then you talk about, when you're presenting a case in court or something like that, we're talking about, well, how does this affect this person's activities of daily living? There's different questionnaires where you can categorize objectively, well, as close to objective as you can. Like they'll say, well, I can't read like I used to, or I can't last any more than 5 minutes of reading, or I can't do this, or I can't do this activity, I can't lift up my kids, I can't do this, I can't do that. So it's describing things that they do as a normal activities of daily living, like if you're washing the dishes, doing the laundry, things like that. Because when somebody has an injury, it's going to restrict their ability to do certain things. And then you have pathologic forces. So those are basically abnormal forces where you're talking about traumatic situations, things like that. And you can have acute trauma, or you can have effects of trauma that build up over time. If you do some repetitive activity over and over again, if somebody's lifting bales of hay all day long, sooner or later something might happen. So again, this is kind of moving into a little bit more detail on some of the same things. So statically, again, you're going to have gravity or posture that's going to act on the body. And those are typically going to affect weight-bearing joints, okay? Hips, low back, knees. People that have osteoarthritis, which is wear and tear, they're usually complaining of back pain, hip pain, knee pain, things like that, ankle. Not sometimes in the shoulder and the neck, but more often in the larger, the weight-bearing joints. And then dynamic things, we're talking about muscles that are pulling against resistance. So sometimes people can get stress fracture where the muscle keeps pulling on the bone, or you have things like plantar fasciitis, where the tissues are pulling on bone, and it has to do with movement. So you can have like mechanical low back pain. So mechanical low back pain is something where somebody describes a certain incident where they did some certain activity and then that produced the pain, and that pain is reproduced with activity. Whereas the other opposing pair of that is neurogenic low back pain, where that's where they're talking about like nerve pain down the leg, but we'll get into that later. But just understand the idea that it's dynamic, meaning that there's movement involved.
Would that be the static then, what you were just talking about with nerve pain?
No, because it could be either one actually. But it could have happened as a result of trauma, like maybe they herniated a disc by doing some type of activity, or they could have a herniated disc that just over time cumulatively of static posture. So we get into a little bit more into that into ONE2, or maybe when we get into lumbar or cervical. And then again, you can do different functional assessments for activities of daily living. There's different questionnaires. I think I have them up on the ONE2 on the SCARE site. There's an osmometry questionnaire, a neck pain disability index, where you come up with a certain number out of 100 that you can use it to assess. Like if you do an initial intake on somebody and they have this level of pain documented on the questionnaire, and then you do it again later and they have a decrease, and that's showing that you're documenting improvement in treatment. A lot of times if you're dealing with insurance companies or outcome assessments, you need to have a way to show that the person's improving. Okay? And then basically we're talking about pathologic, either going to have acute trauma or repetitive trauma. Like when you talk about an ONE2 and you're doing a history, one of the main questions you want to know is was there a specific incident that brought this on, or did it happen gradually? And when patients come in, you want to know, okay, did this happen because you fell off the roof, or is it because you've been playing tennis for years and years and now your elbow's starting to hurt? Okay, so let's we'll take a break at this point, and then I'm going to show some video stuff on mechanics and injury and stuff after that, and then we'll go through some of the basic stuff. One of the things about that video, though, where he falls on his shoulder, they were showing the ligaments in the glenohumeral joint, okay? But with a fall like that, where you land on this, we'll get into that shoulder mechanics later, but they said his collarbone separated from his shoulder. When you say a shoulder separation, that's usually an AC joint, which makes sense with what they're saying, collarbone and shoulder. So really what happened was he probably had an AC separation, not a shoulder dislocation, which is what the video makes it look like. But just discrepancies there. So what did you think of the video? I mean, it's good because it gives you a three-dimensional input, but there's 4 hours of it, so we're not going to watch the whole thing. So. So now this is stuff should be kind of review type things where we're talking about in anatomy you need to, it's like speaking a foreign language, okay? So we have to learn how to talk and sing, okay? So we go through different things and we understand what they mean, because there's certain words you're going to use when you're going to talk about anatomy and injury and mechanics and things like that. Okay, so y'all remember your anatomical position. Okay, this is another one of those. Going back in time, right? Remember your anatomical position, right? Okay, and then you may remember the different paired terms where you have superior, inferior, anterior, posterior, medial.